Let's talk about something that I know can cause a lot of anxiety. Maybe you had a scan for some reason and the report comes back mentioning an incidental spot on your liver. That phrase alone can be quite concerning, and today we are going to demystify what one of those lesions can be, which is really common and almost always a harmless finding called hepatic hemangioma. So let's start with the exact scenario. You go in for, say, an ultrasound or a CT for something completely unrelated, and your doctor brings up an incidental spot on your liver and they tell you it's an hemangioma. Just hearing these words can make your mind jump through multiple scenarios, and it's completely natural to be anxious. But I want to reassure you that these are incredibly common, and the vast majority of these are completely benign, which is just a medical term to say non cancerous. So, the first step is to figure out what exactly this spot is. Not all findings are created equal. So, one of the most common things here is hepatic hemangiomas, and we just spoke about the simple cysts in a different video. So, here looking at hepatic hemangiomas, this is the most common solid benign lesion, and the easiest way to wrap your head around it is a little tangle of blood vessels that's basically like an internal birthmark, just happens to be in the liver. A key thing to remember is it is not cancer and does not turn into cancer. Now, on the other hand, we have other very common findings like cysts that, unlike hemangioma that we just talked about, is not solid and it usually has a thin walled sac filled with fluid. And just like hemangiomas, these are also common and also benign. Looking at them side to side really makes the difference. The hemangioma is a solid cluster of blood vessels, while the cyst is a little pocket of fluid. But what's absolutely crucial is what they have in common. They're both typically benign and they're not a cause of alarm in the overwhelming majority of cases. So, a very natural follow up question is why me? Or just how common is this really? Understanding how many people walk around with these can be very reassuring, and the number is quite surprising. In different series, up to 20% of scans have shown hemangiomas. That means around 1 in 5% could very well have one. This really drives home how routine these lesions are, especially as we do more and more scans. There's a pretty clear pattern on who usually gets these, usually found in adults between age 30 and 50, and much more common in women. The vast majority are small, we are talking about less than 5 centimeters, and they tend to sit there and not change over time. Now, we've seen a connection with hormones like estrogen in other lesions like adenoma, which are also more common in women. In hemangioma, the connection is not entirely clear. So, if these are so common, you may be wondering how we can be so sure what to do without invasive things like a biopsy. Let me walk you through the diagnostic path, which really relies on imaging. Usually, the process is it might pop up on an ultrasound first as a bright spot, but to be absolutely sure, an MRI with contrast or a CT with contrast is usually the best. There is a hallmark finding on MRI which looks at a T2 weighted image and the hemangioma is bright. And the way the blood flows through it during contrast injection also helps us to make the diagnosis confidently. And this is the main point, as this quote highlights. The way a hemangioma looks on these scans is so unique, so characteristic, that in most situations we can make an accurate diagnosis without ever needing a biopsy. And that, of course, is great news for patients because it avoids unnecessary invasive procedures. So, this brings us to the next question: is treatment necessary, and how do we manage these lesions? Let's go through the standard approach of managing them. First, we ask a very simple question that covers the vast majority of patients: is the hemangioma on the smaller side? Generally less than 5 centimeters, and you're feeling perfectly fine with no symptoms related to it? If the answer is yes, then the standard approach is simply reassurance. That is it. For a typical small asymptomatic hemangioma, you don't need any treatment and you don't need routine follow up scans to keep an eye on it either. We reassure you that it's a benign finding and we can leave it alone. But you may be wondering about less common conditions. What if it is large? What if you do have symptoms? Maybe some discomfort in your abdomen? How does the plan change then? Well, even in these cases, the approach is very careful and very measured. The first thing we do is to actually see if the pain is coming from the hemangioma and not from something else like gastritis or reflux or gallstones. And if a larger hemangioma is causing trouble, we may follow up with another scan to confirm that it's stable in size. It's really only in rare cases of very large hemangioma, which is clearly causing the symptoms, that we consider interventions like surgery or embolization. So let's boil this all down with the most important takeaway, the point you should remember, even if you ever get this diagnosis. This is the bottom line. First, they are extremely common. They can be found in up to 1 in 5 patients. Second, they are benign. That means they are not cancer and there's no risk of becoming cancer. Third, they rarely cause symptoms or require any additional treatment. And finally, our ability to diagnose and treat them is great. And using MRI or CT, we can do this confidently. Being informed is truly the best tool for you to turn that anxiety into calm understanding. Thank you.